I saw a post on a dental Facebook group. The anonymous poster was bemoaning the fact that within dentistry, dentists and practice owners had to just eat so much crap. Insurances deciding not to honor what they said they were going to pay. And I'm just thinking, like, these are problems that you're complicit in. Most people have these challenges in their lives that they may not be necessarily at fault for, but they're complicit in.
Recently, we made a mistake. We were usually working through operational issues. However, someone messed up the math formula. They just bombed it. They misquoted them by about half, and we're just getting started. Great learning opportunity. In Full Arch, like, you're gonna have things that happen that you didn't expect. Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field so you can grow the way that you want. And today I have Dr. Alex Sharp, who's going to be breaking down how to properly communicate. One of the biggest obstacles that we see in Full Arch is that doctors don't understand how to communicate to their patients and to their team. And Dr. Alex is going to do a masterclass on how to actually do that. If you didn't catch the last episode, go check it out. He broke down of how he scaled 37 practices all in Full Arch, and it was a really good episode. So this one is a little more niche, but if you are doing anything in Full Arch, this is going to be something that's going to help you, your patients, and your team. Stay tuned. So what are some of the things that you've seen where doctors have figured this out, how to like turn that office? I don't want to turn this into like a whole culture talk, but just from a communication standpoint, what are some things that are like easy W's to help doctors get on the right page with their teams?
Voting is open on Dental Woo's Top Dental Podcast. Starts on November 1st and ends on December 31st. Each vote supports the podcast. Last year, we won multiple top spots. And this year, we're hoping to do even better. This year, our goal is to get 1,000 unique voters on this podcast. Help us reach our goal, and your vote will count. Here's how to vote. There's a link right down below. Just click it, go there, and give us a thumbs up. That's all you need to do. Go to dentalwoo.com/vote or click the link below and then find Dental Marketing Go and then submit it. Super fast.
Don't put yourself on a pedestal. That's number one. I mean, I learned that the hard way. Back in the day when I was trying to build something resembling a decent workplace culture, I bought a practice, and it was my first practice. And I came into a situation where all of the team were just on pins and needles and like nervous because I had said, treat me the way that you treated, the seller. And they were just scared and scared of their own shadow. And I was like, what's going on? Well, I've come to find out that in that practice, there was a moratorium on laughter. They were not allowed to laugh. Like, it was unprofessional to laugh. You get written up if you laugh. And I'm like, okay, that's just bizarre. So I said, okay, effective now. We want laughter. We want like conviviality. We want music. We want there to be good vibes because it's a freaking dental office. Like, no one wants to be here in the first place. So if there's zero laughter in the building and it sounds like a crematorium or something in here, then it's just terrible. So that was one thing. So I listened to what the team needed. I observed what I saw and where we needed to improve. And then this is another one that's ripe for misinterpretation. But the book. This is a book I recommend everyone read. I gave it to all of our doctors a few months ago. But Legacy, the book that's about the New Zealand All Blacks and like their culture around, serving one another and making sure that we're putting the team's needs before our own individual needs. It's a great read. And one of the precepts in there is that they talk about sweeping the sheds. They talk about even the captain of the team or the coach of the team or the owner of the team. Nobody's too good to do the work that needs to be done. And it's easy to overdo that, meaning in a practice, you don't have to be spending your time flipping a room, sterilizing a room, if there's a patient to be seen, if there's a surgery to be done. Like, there's a time and a place to demonstrate that you're not good enough, you're not too good to do certain tasks when you're behind, when someone's out sick, but you don't want to fall into, hey, I'm doing things that don't require a dental license to do. So again, fine line, but I think being able to humble yourself enough to be on the same page with your team goes a long way. And again, that's easier said than done for a lot of us.
Do you have any tips on communicating between your mentors or the other people that have to help you get leveled up on your communication. Not just it's still internally, but it's kind of like your secondary team.
Great question. So to be a good student, you have to want to learn. And sometimes that involves getting outside of your comfort zone and trusting in the process. So early in my career, I was recorded during new patient visits, new patient consults without really understanding the value of listening back to game film at the time. But I think that kind of thing is really valuable. Like getting over yourself and understanding that, man, I may not like listening to myself in a consultation, but I'm going to get better so friggin' fast by listening to all the ums and ers and likes and filler words that you don't like saying.
I'll say this real quick. This is common practice in sales and marketing.
Of course.
Across the business world. You do not get to do any sales anywhere for any reason without listening to your own calls. And usually they listen to your calls in a group so that everybody can learn either the right way or the wrong way, and then how to do right. Like, so it's so funny to me because we'll bring calls, not doctor presentations, just phone calls to doctors and to their teams. And they're like, don't ever embarrass us like that again. And it's like, what do you, you guys, this is you guys, this isn't me. Like, this is you guys answering the phone that I'm bringing back to you guys. Like, this is a problem. We need to fix it. And so for whatever reason in dental, people don't like doing that. It's a very taboo thing still.
It's the darndest thing. That's one strange anomaly among many where dentistry, I think, considers itself outside the rules of like normal business, which I guess you could make an argument that some of that's good. But I saw a post on a dental Facebook group 2 or 3 days ago where it was an anonymous poster, and the anonymous poster was bemoaning the fact that within dentistry, like dentists and practice owners had to just eat so much crap with like insurances deciding not to honor what they said they were going to pay, or patients demanding refunds for work that was well done, and like people, like team members really running afoul of people's generosity. And I'm just thinking like these are problems that you're complicit in. There's a great quote. I can't remember the exact quote, but it was this executive coach to the stars that Tim Ferriss interviewed the other day, Jerry something. And he was talking about how most people have these challenges in their lives that they may not be necessarily at fault for, but they're complicit in, that you have a role in allowing. Even if you weren't the one that like pulled the trigger or made the move or did whatever, like you're complicit in that situation happening because of some degree of involvement. And I think as dentists, it's incumbent upon us to really get clear on what our guardrails are and only accept what we want to accept. And I think for those of us that are passionate about full arch, it's a little easier. And what I mean by that is it's easier to say no to PPO involvement. It's easier to say no to not valuing the quality of what we offer. It's easier to push back against some of the rising tides of distrust in the industry because we can fall back on the quality of what we do. So I just think it's okay to draw a line in the sand. And that's an important distinction because you don't have to be walked all over. And there's plenty of people in this world that want to walk all over dentists, and you don't have to allow it.
Agreed. Was it Jerry Tack that was on the Tim Ferriss? Is that the right name?
I looked it up. To look. It was like the title. It came out like a week ago or less, and it was Tim Ferriss interviews Uncle Jerry.
Yeah, Uncle Jerry Tack. Yeah, that's right. Yeah, okay. Uncle Jerry Tack. Yeah. Okay, so all right. So recently we made a mistake. So when somebody comes on to work with us, they come in and we figure out, okay, here's where their new patients are at. Here's where they want to go. How many leads are we going to need to generate to get them to that goal? What is their conversion rate on those going to be? What's the average office at? What are they at? Are they below average, above average? And then we go back and we say, okay, here's your investment to get this many leads. And if you do these things, you'll get this many new patients, right? Pretty straightforward. And there's times where there's quality or quantity issues on our end and we got to figure that out. But most of the time it's like we're usually working through operational issues. However, someone messed up the math formula. they just bombed it, right? Like they actually got it wrong. They misquoted them by about half. And we're just getting started, right? And so the team came and said, how do we fix this? We've never had this problem before, right? And we're month to month. It's different than Full Arch where it's like you pay once, right? So if you mess up, you kind of messed up forever once you do that. But for us, it's month over month over month over month, forever potentially. And so we had to have a long conversation of the right way to handle this, right? And the right communication. And it was a great learning opportunity. In Full Arch, like you're going to have things that happen that you didn't expect and that the patient didn't know about or your team didn't know about. How do you think through having those kind of conversations?
It's interesting because I look at it as, again, falling into the realm of what are our controllables versus what are the things that you just can't control for. And what you want to do is to first think through what are the common issues like what you're describing that come secondarily out of things that we could have controlled on the front end versus these are just like acts of God, things that happen that you just have to say, you know what, this may not be my fault, but I guess it's my responsibility. So big distinction there. But I think, a well-meaning patient is trying to follow post-op instructions. They bite down the wrong way on some food and it fractures the healing prosthetic. Well, okay. Not our fault, but our responsibility. And everyone falls differently along the spectrum of, are we going to charge the patient for an oopsie? Are we going to do them a solid and come in and repair it? That's, person to person. But I do think that distinguishing between things that we have documented that we've informed the patient about that could be a potential pitfall versus like, oh, we just got to eat this because we screwed up. We didn't set expectations appropriately. We didn't go over post-op instructions thoroughly enough. We garbled the treatment plan and we misquoted the fee. Are we going to honor it? Like those kinds of things, I think, are highly unique and highly specific to each practice team. And again, the more that you can think through those common categories of customer service mishaps, the more that you workshop those yourselves internally, the better you're going to handle those. And with dentistry, yeah, there's a lot of them, but really they do fall into several individual discrete categories. And you just have to have a philosophy that you can operate within.
Yeah, I love that. And just an easy hack for everybody. Well, first of all, this is like sales 101. Every sales department out there, what they do is they go to the sales department collects all the questions. So they get a Google Doc, and every time there's a sales question, they drop it in there. And then if someone comes in and asks the same question again, they're like, oh, there's the same question again. And then they just figure out what all the sales questions are going to be. All right. Because over time, you have every sales question now, and there's usually 5 to 10 of them. And then you go and put that into your marketing, right? You just go, hey, we do this, because you just answer the questions that they have. This is like common business practice. But I love that you even took it even further and you put it into, okay, what are the things that are going to go wrong? And if that seems overwhelming to you, because I remember when the first time I heard about this, it was a little bit overwhelming to me. Like, how am I going to get all this information? It's really simple. Google Doc it, drop the problems in there, like try to think of the problems and then track the problems. Hey, this was a problem. This happened again. This happened again. If you see things happening over and over again, then you have to take that problem that's happening at the end, move it all the way to the front, right? And the bigger the problem it is, the more you got to talk about it, right? The more you got to talk about it in sales or in the treatment presentation or post-op or whatever. And if it's still a problem, then maybe you need to make a video about it, right? Or maybe you just start to build different ways of communicating about it. And it actually does solve a lot of those friction points. So I absolutely love that. That's a great tip.
Yeah. And I love what you said too, about just having a raw list of questions that you get during the course of a consultation, or to your point, problems that arise after treatment is rendered, and then just cataloging that and being ruthless about keeping that data front and center and using that to improve or communicate better or refine operations. It's so straightforward, but so powerful. So thank you for sharing that.
Oh yeah, absolutely. What we do, so our sales department, anytime they get a handful of a new question, because in marketing, the questions are changing all the time, right? So it's like, what's the next social media platform as an example, or what do you guys think about this new platform that just came out? Maybe, right? So if they hear that 4 or 5 times, they just Slack me. Slack is our internal communication. And they go, hey, Gary, people keep asking about this. Can you just make a quick video about it? And then it takes me 5 minutes. I make a video about it. And then we include it in all of our documentation. It's in our marketing. It's in everything. And so they're going to get that answer before the goal. Perfect marketing and perfect sales is only this: answering all the questions that the people have already before they even ask them, before they even know that they have those questions yet, right? Because the patient they don't unlock the next set of questions until you give them the information. So if someone's on Google and they type in full arch, they only have so many questions about full arch, like how much, does it hurt? You know what I mean? How long does it take to heal? There's only a basic set number of questions until they visit your office or talk to you on the phone. Now they just unlock the next gate. And the more that you can answer those questions in advance, the more trust you get. I think about it like trust points, where they start to move through your trust centers. And then from there, now you're the expert because you educated them from A to Z. And then when they come in, it's just this smooth process because you've already knocked down all their objections. You've already answered all their questions. And that's like the ideal situation. I love this topic. I think it's really interesting.
Yeah, it's all about front loading, right? Like you put as much emphasis on the top of the funnel, education. And I guess you could look at that as education/filtration, because you could be educating people and thus filtering out the non-viable leads. So it's like a double win.
Yeah,
like a net positive.
And it's automated. So that's the part that most people miss. And you just brought it up, is like, it's top of funnel, bottom of funnel. You can't really automate. Like, I'm not going to buy full arch from a computer, right? I need a human, but the top of the funnel is 100% automated. And so you are making one video one time, and you make a bunch of them, obviously, but you're making one thing one time, one resource that then filters and educates and gains trust all the way through without any human interaction. That's the beautiful part about doing it properly, is that you weed out it doesn't take you as much time. And you can take somebody like yourself. I'm sure everybody's like, well, I want to sell like Dr. Alex does. I want to sell as many arches as him. Well, they probably can't yet, right? It's going to, you've developed this over years, but they can take you and move you up at the top of the funnel to have those conversations, or at least get the scripting from you to implement those things at the top of the funnel.
Right. And I was talking to a colleague the other day, and we were talking about audiology. We were talking about like the practice of fitting people for selling hearing aids. And we were talking about the relative simplicity of that model relative to dental care, because generally in that model, they have the basic, the mid-level, and then the Cadillac, I guess, like types of hearing aids. And the way that this particular company that we were discussing was doing it was they were doing exactly what you said. Like at the top of the funnel, there was the video to set expectations with the right verbiage, push on the right buttons, address the common objections. And then when the patients come into the business, it's the same thing. There's a different video addressing different things. And then basically the audiologist just comes in and does the final pitch or the final clarifications, and then it's a done deal. And so I think that obviously there's only so many parallels you can draw between hearing aids and dentistry. Dentistry feels a lot more personal, a lot more vulnerable. There's different moving parts. It's less of a binary, I can't hear, I can hear, to like the gradient of dentistry. But I still think that it's important to not overcomplicate what we do. Because we tend to, again, think dentistry is different, think that dentistry is this completely unique thing, and there are unique aspects of it, but it's good to look at what other adjacent fields are doing so successfully, and what can we borrow from those?
Yeah, I love those. I love the 3 packages, because the 3 packages is all that is selling again, right? So what you do is the middle package is usually the one you want everybody to buy. That's the one that your margins are perfect. Everything's perfect. Your top one, you don't want everybody to buy, but if they do, the margins are so good on it. Like you're like, whatever. And 10% of people just buy it just because it's the top one. Right. And then you have the bottom one, and the bottom one is kind of the one that you use to get people into the funnel. Like, and you see this all the time with the Mercedes and Cadillac. Only $499 a month. Yeah, for the base model that no one buys, that you don't really. It's like it doesn't have power steering. It doesn't whatever, right? Like
it's got a tape deck in it.
Yeah. And then you look at it and you're like, well, I don't want that one. But it gets you in the door, and then they upgrade you to the middle one where they want you. And then if you buy the top one, it's like whatever. Those. I think something like that around full arch would do really, really well. But doctors, there's so many variables with the body that the doctors push back on, and they're like, no, we can't do that because there's the variables on the body, which I get. You could potentially weed people out afterwards, though. But
yeah, it's generally like a restorative materials discussion, like the cost of being able to render the lab fee and to get the material that the teeth are made out of. Like that's usually the breaking point for that, and that's why the cost has to be what it is, because of the cost of the lab fee. And one way to think about the optionality in dentistry is door number 1 dentures, door number 2 overdentures, door number 3 fixed, and then those
probably have ranges.
Those are a bit more distinct levels than maybe we would like them to be. But I do think in the future, I do think that with the way that the biomaterials are evolving, I think you're exactly right. I think you can, within all on fours, you could probably have the door number 1, door number 2, door number 3 with different warranties.
Yeah, that's what I was just going to say. Is with the this one is a 3-year warranty. This is a 5.
Yes,
this is
exactly.
Mm-hmm.
Yes,
that's really cool. I love that. And people, that would speak to people, because that's all people understand is like, can I eat with it? They expect to be able to eat with all of them, right? Can I sleep with it? Do I have to take it out and clean it? Yes or no? And then it's like, how long does it last? If it fits all the comfort things that I can do my normal things, then the only question is, how long are you saying this thing's going to last? And I think that would absolutely crush in full arch. But I know there's other things that got to get into place before that can happen. So, go ahead.
No, I was just going to say, I think it's a matter of when, not if, that type of segmentation of the options happens, because most people prefer fixed. Most people see the value of fixed. Obviously, the implants being in the bone help retain the bone. It's good for the body. So yeah, it's just a matter of time till the materials catch up with the price points that people want to offer.
Love it. Great conversation today, Dr. Alex. I really appreciate you coming on. If someone wants to reach out to you and get in contact with you, what's the best way to reach out to you?
Yeah, sure. My email address is alex@sharedpractices.com, and I'm also fairly quasi-active on LinkedIn. So those are probably the 2 best ways to get a hold of me.
Awesome. Thanks so much for coming on.
Hey, thanks, Gary.